Let's have a discussion on the pelvic fracture. Now, before actually talking about the pelvic fracture, it is important to have a recognition of the important landmarks in the X-ray of the pelvis, including both hip, AP view. Because every time you get a fracture or a trauma in and around the pelvic bones, then the most common X-ray that you are going to get, or you have to order, is the X-ray of the pelvis, including both the hip, anterior-posterior, that is AP view. And what all are the important landmarks that you should be aware of by reading this X-ray. So let's have a discussion on this. Now, first of all, the things which you already are aware of, that this is the head of femur, this is neck of femur, this is neck of femur, and this is the proximal aspect of the femur, and this is the acetabulum. So we are not going to talk anything. This is acetabulum. So this is already you are aware of. This is superior pubic ramus, and this is inferior pubic ramus. So we are having a superior and the inferior pubic rami on both the sides. This is the greater trochanter, all right, and to some extent, because it is not internally rotated, the hip joint is not internally rotated, so here somewhere is the lesser trochanter of the hip. So these are the structures which you already are aware. Similarly, this is the iliac crest, this is the iliac bone, this is the sacroiliac junctions, all right, and these are the obturator foramens. As I told you, all these things you are already aware of. Now, the things which you might not be aware of are, or the things that you have to understand is actually, are the iliopectineal and the ilioischial line. You see, this is the line, and this is another line. This one is the another line, all right. Now, this line, which is extending all the way up to the superior border of the inferior pubic ramus, actually is representing the ilioischial line, and this ilioischial line is actually representing the posterior column of the acetabulum. So it is representing the posterior column of the acetabulum, because acetabulum is a three-dimensional structure which is having the anterior and the posterior columns. And what are the structures which could be affected, whether it is the anterior or the posterior column which is affected, is to some extent is going to be identified by having a brief description of these lines. Then over here, the line which is created, this is known as iliopectineal line, and this iliopectineal line is representing the anterior column of the acetabulum, all right. So it is representing the anterior column. Imagine if there is a fracture line which is involving this iliopectineal line, then possibly the fracture is anterior in the anterior column of the acetabulum, or the anterior part of the acetabulum. Now, if you look very closely, so this is the floor of the acetabulum, all right. These are the articular surface of the acetabulum. But here there is a line which is very clearly distinguishing, a very clearly distinguished line on the posterior aspect, and to some extent we are having a distinguishing line on the anterior aspect also. So this is actually the anterior border of the acetabulum, and always lateral is the posterior border of the acetabulum. So this is the posterior border of the acetabulum. So these are the things which are very, very important for you to identify. There is another line of significance, and that is Shenton's line, which is imaginary line which is drawn on the pelvis, including both hip X-ray, which is starting from the inferior border of the superior pubic ramus and extending all the way up to the medial border of the proximal femur, this one. So this line is known as Shenton's line, and the significance of this Shenton line is that normally it is a smooth curve, all right. In case of a normal hip, it is a smooth curve. If this line is broken, then it is significant, or it signifies that there is any pathology which is happening at the level of that affected hip. So these are the lines which are important for your understanding, basic understanding. Is the iliopectineal line, which is representing the anterior column of the acetabulum, the ilioischial line, which is representing the posterior column of the acetabulum, the Shenton's line, the anterior border and the posterior border of the acetabulum, which to some extent could be delineated or demarcated. Now, having this much of the background in your mind, now we can go ahead with, or we can project with the pelvic fractures. Now, every time the patient comes to you with the pelvic fracture, before even stabilizing those fractures, it is important to have the basic measurement of the blood pressure of the patient, because there is a huge amount of the blood loss which is always associated with the pelvic fractures. You know, around 3 to 4 units of blood is lost in major pelvic accidents. So it is extremely important, first of all, to have a generalized survey on the patient. Then you also have to look at the urinary tract. That means if there is a passing of the normal passage of the urine or not. In that case, you have to infiltrate, or you have to apply a Foley's catheter also, in order to look the passage, or in order to look the color of the urine through which it is coming out, because it might also signify the bladder injury which is associated with those pelvic fracture, or which could be associated with the pelvic fracture. So before even you go for stabilization of the pelvic fracture, the basic generalized survey of the patient for shock as well as for bladder injury is essential. Then comes the, for you, means for examination purposes, what is important for you to remember are the eponymous fracture or the named fractures. Now, before we talk about the eponymous or the named fracture, it is important to have a consideration, or just the name in particular. What are the names of classification for the pelvic fracture? Just the names in particular you have to remember. So first one is Young and Burgess classification, and the other one is Stiles classification. Now, out of these two classification systems, it is Young and Burgess system of classification which is existing, which is also responsible for defining the mechanism of injury, and it is also responsible for dictating the management or the prognostic outcome related to this fracture. That is why the classification system which is used in order to classify this pelvic fracture today is Young and Burgess. All right. So we are going to have a brief discussion of all these pelvic fractures under the sections of eponymous fractures, and we are going to categorize these fractures according to Young and Burgess system of classification also. But before that, let's have a discussion of a very basic fracture or very basic injury to the pelvis, that is open book injury to the pelvis. So the first eponymous injury to the pelvis is open book injury. Now, what is open book injury to the pelvis? It is pubic diastasis. Now, what do you mean by the term pubic diastasis? It is actually the separation of the pubis. Now, if you look at the normal X-ray, normal pelvis including both hip, now this region is the pubic region, and here we are having the articulation of the pubic rami, all right, which is connected by an interpubic ligament. Now imagine, because of any force which is directly hitting this interpubic ligament, it might rupture this interpubic ligament, as a result of which there could be a separation of the pubis, and this separation is responsible for opening the pelvis like a book. That is the reason why it is called as open book injury to the pelvis. Now, what is the mechanism which is responsible for causing this type of injury? The mechanism is the antero-posterior compression. That means if a pelvis is subjected to the antero-posterior force, it will result in the tear of this interpubic ligament. So there will be opening of the pelvis like a book. So it is a result of an antero-posterior compression injuries. That is a mechanism. And if you want to classify this condition, if you want to classify this open book injury according to Young and Burgess, then Young and Burgess type 1 injury. So it comes under the category of Young and Burgess type 1, because Young and Burgess type 1 injuries to the pelvis are because of antero-posterior compressive forces. This antero-posterior compressive forces, according to Y and B classification, is further categorized into type 1A, type 2, type 1B and type 1C. But you need not to go into the details of what are the additional injuries associated with this antero-posterior compression. Remember, we are going to restrict ourselves in order to mark the correct answer which could be asked in your examination. They are not going to project with the further severe kind of the injuries related to the pelvis according to Young and Burgess. All right. So restrict yourself in identifying the open book injury to the pelvis due to antero-posterior compression, categorized under the heading of Young and Burgess type 1. Now, second type of eponymous fracture is the crescent fracture. Now, what is happening in case of crescent fracture is that if the pelvis is subjected to a lateral force, so in crescent fracture, what happens? There will be a fracture of the iliac bone, which extend to involve up to sacroiliac joint. All right. So it will be a fracture of the iliac bone which is extending all the way up to the sacroiliac joint. Now it is not very difficult to understand that if the pelvis is subjected to a lateral force, then the first bone which is going to be encountered will be the iliac bone. So it will result in the iliac bone compression or iliac bone injury. So the mechanism for causing this kind of an injury is the lateral compression injury. All right. And all the lateral compression injury are classified according to Young and Burgess as type 2. As I told you that type 2 injuries are further classified into type 2A, type 2B and type 2C based upon the severity, based upon the associated injuries with the lateral compression. But you have to restrict yourself in understanding about the crescent fracture only. You know, open book injury to the pelvis has been asked question. Crescent fracture to the pelvis is a question which they have already asked. Now, crescent sign is something which you are going to or you have studied in avascular necrosis head of the femur, which is entirely a different topic. For this particular topic, crescent fracture to the pelvis is the fracture of the iliac bone which is extending into the sacroiliac junctions. All right. So it comes under type 2 injuries. Then comes the Malgaigne fracture. Now, imagine if a patient who is falling from height at the time of impacting with the ground is landing on one foot. So the force he is transmitting to the ground, the foot will be subjected to equal and opposite force by the ground, and that force will traverse all the way up to the level of pelvis, thereby disrupting both the anterior and the posterior structure, leading to upshifting of half of the pelvis. So it is actually the upriding of hemipelvis. It is a kind of a vertical shear injury which results in uplifting of half of the pelvis. So what is Malgaigne fracture? It is upriding of hemipelvis. Half of the pelvis moves up. Now what it is due to? What is the mechanism? It is due to a vertical shear injury. All right. As I told you, if at the time of falling the patient lands on one foot, so the force he is transmitting to the ground, the foot will be subjected to equal and opposite force by the ground, and that force, if it is transmitted all the way up to the pelvis without any blockage or without any fracture in the ankle, in the leg, in the knee or in the thigh, it can result in the breakdown of the anterior and the posterior structure, which will result in upriding, unstable kind of a fracture where there will be upriding of the half of the pelvis. All right. So upshifting of the half of the pelvis is because of a vertical shear injury. And if it has to be classified according to type, Young and Burgess, so it is Young and Burgess type 3. You know, vertical shear injuries comes under the category of Young and Burgess type 3 injuries. All right. So this much you need to remember about this eponymous fracture. Another eponymous fracture is the jumper fracture. It is the fracture of the sacrum. Now, all of you know that athletes who are involved in long jumps, at the time of impact, when they rest on the ground, they might break their sacrum when it is impacted against the ground. So it might result in the fracture of the sacrum, known by the name of jumper fracture. Straddle fracture is the fracture of all four pubic rami. You know, when all four, you know, there is a set of 4 pubic rami, the superior inferior on the left side, superior inferior on the right side. When all 4 of them are fractured, it is known by the name of straddle fracture. It is again an unstable kind of an injury that has to be managed. All right. So this is about the eponymous fractures of the pelvis. As I told you, it is important to have the understanding of these basic lines that we have talked about, and now it will become much easier for us to identify everything related to the fractures in the acetabulum. I told you iliopectineal line, ilioischial line, the Shenton's line, the anterior column, the posterior column, the anterior border and the posterior border. Now it will become much easier for us to identify or talk about the acetabular fractures. The topic is fractures of the acetabulum. You know, it is a huge topic to be discussed, and it requires very specialized kind of the approaches in order to manage it surgically. But for your examination, what all is important for you to remember about the acetabular fracture, first of all, are the names of classification. You know, Letournel and Judith. So they have classified the acetabular fractures into 2, the primary and the secondary associated fractures of the acetabulum. You need not to go into the details of what those 5 and the 4 primary and the secondary type of the acetabular fractures are. All you have to restrict yourself in remembering this term, Judith. You know, the key term under the acetabular fracture is the Judith. All right. Why? What is the other reason? This Judith word is very important.